It's not the equality, but the equity. You use your time best for the people who use it and need it more. And the great part is that when you have a list where people report how they feel, it's undeniable, it's clear, and you speak the same language because you already heard what they feel.
If there's something you would say to other GPs, what should they really invest in if they want to reduce the administrative burden? Okay, my name is Fred. Today I'm going to interview Lucas. Lucas is here with me, and Lucas, we know each other for quite some time, right? You remember how we met each other?
I do, yeah, with the sports of our sons.
Yeah.
And then we had some good times here chatting about everything we like, and have a big field of shared wishes and entertainment and visions on the future.
Yeah. Maybe you can a little bit introduce yourself. What's your background and what's your profession?
Well, I'm a general practitioner. I work here in the Zwolle area, and I have a nice big practice, and I've been working there and actually also looking for ways to improve my quality on many levels. And this, we have a shared interest in one of those levels.
Yeah. Correct, great, yeah. As I explained to you, in Qubiz Healthcare we have this framework, we call it CARF, the Continuous Administration Reduction Framework, and it has 5 phases. Is it okay if we go through those phases and see what it means in your practice?
Absolutely.
What administrative burden is about? Because we really want to understand what's your core problem and how an organization like Qubiz Healthcare can help you to reduce
what are our core problems, yes, and how do we get a very intelligent and highly qualitative solution to it?
Yes. So it would be great if you... Maybe to start with the first phase. The first phase is really about understanding what is actually the problem. So can you share with us in your practice, how do you see the problem of administration in a broader sense?
Well, I will bring it to one of the most common ones that is now, but it's complex because there's also things, we also make the problem because we want to be giving high service and high quality to the clients, and that takes a lot of control, and that control is also making that you put in extra steps which are making it less efficient.
Yeah.
So if you used to have one doctor and one assistant, they talk to each other, and not a lot of data got lost, you know, in the process. And when you get into bigger centers, which is the way to service better nowadays, and to have a better continuity, and especially with the workforce changing, then you also need different ways of communication. So if a patient calls, first get the question, put the question out, get an answer, go back to the patient, answer change, and it's coming back and forth. We have digital ways, we have the telephone, we have WhatsApp, we have Facebook, we have all these ways to communicate, but it's not, it takes more steps than you would want it to take. You would love to have somebody have a question, put it in, and be answered and be done with. But it can go up and down, and then there can be confusion. So we are losing time that way. And the time that we're losing, patients notice this because, well, wherever you call a healthcare professional nowadays, you'll be in waiting. And especially in the emergency department, but also on other areas. And we are losing a lot of time, of course, also from all the questions we get, because people can't get healthcare anywhere else, because there's a flow problem at the moment in healthcare, in the hospitals and in other areas. So people have more questions, more interactions, and I want to make sure that they are answered really well, because else you get a problem. You get calamities, you get health problems, you get trouble in all kinds of ways. And of course we don't want that, so we make it very tight to make sure we don't miss anything. And that means that there's a lot of interaction. We have a very well structured system where questions come in our agenda and we can answer that, but it's back and forth, which is not efficient for the patients, not efficient for the assistant, not as efficient for us as doctors. And that's just one example.
And maybe you can tell us a little bit about a product that you envisioned and that we built together, the AMAT product, if you remember.
Yeah, of course I remember.
How was that envisioned, and how does that help?
Well, the idea of AMAT was to let people consume more health without consuming less health care. We wanted them to look in themselves, and we work of course with challenges, but also with monitoring and all kinds of things. So people are doing the work they need to do for themselves, getting involved, taking their responsibility in it, and also working on themselves and getting products to help them with that. Of course we have our challenges for the health foundation, that people learn to sleep better, have stress reduction, all the things that make it better and make sure that there's an agenda so they can always go back to it and learn how to do it, and with a stepping stone get more health skills along the way. And in the meantime help us with bringing in information, bringing in all the things we would usually take time to get. And that's maybe on a larger scale. If you have all this information, how do you make it available for all different levels, so we don't do the health check 5 times over at different areas. So that's one thing we tried with AMAT. And we saw how people reacted to the monitoring. They were more busy with their health, and because they were more busy with their health, all of a sudden their health already started to get better because of that. And they came to the practice better prepared, better questions, actually sometimes not even questions, sometimes they came to tell us their answer to the problem. And that was definitely an improvement to our time management.
Super. I remember that we worked on AMAT, and actually it was a few years ago that we built it, and it was run for a few years also, and now we have some really good results. Can you share a bit of what were the main results that you saw coming out of the AMAT project?
Well, one of the main results was that people were more prepared, but we saw also that actually people who were looking at their health more often, were busy with it more often, started to lose weight because they were more busy with it, which is great, of course. That's like wonderful. That usually takes a lot of effort, and effort in a way that makes people usually feel bad. It makes them feel forced into doing things they don't want to. But when they're actually busy with it, they don't even know they're working with their health. And the not even knowing you're working on your health is definitely beneficial, because you don't get the resistance to it. And in behavior, that's wonderful. If you don't feel resisted to it and don't get a negative feeling about it, but you do it because you're doing something else, and automatically you're doing the next thing, which is great.
It becomes start of a habit. You're changing a habit for it. Can you explain us a little bit what it meant for your workers in the practice, like the assistants? How did their work change, and did it actually reduce their administrative burden?
Well, in that sense, for our praktijkondersteuner, we have specialized nurses who work with chronic disease, and they actually had this. They noticed that people would come there and would say, look, I saw that I was gaining some weight. I already thought that I could plan this and make my weekly schedule different and do this with my food and do this with my exercise. And they came with a plan, which makes it much easier to talk to the patient. The second thing is, when they would used to come to this nurse, they would have to first take the blood pressure, take the sugar, take the weight, do all these measurements, which is part of the time you spend together. And that time is done because the measurements were already done by the patient and brought in by the patient. So that would save time. And you can actually use it later. We didn't get to that point yet, but if you have patients who are regulated pretty well, you also know, okay, you have your right, you just give them the feedback and some extra, and you can start to have a different communication, because you know their numbers are good, their biometrics are good, And when they stay good, you know, these people are taking care of their business and are in a good zone. They don't need the extra effort. They don't need the extra help. Of course, you need to still give them the hey, I see what you're doing here, nicely done. But you don't need to spend as much time on each patient. It's not the equality, but the equity. You use your time best for the people who use it and need it more.
Yeah. Super. Yeah, great to hear. Great to hear. Hey, and if you would envision with AMAT the next steps, what would be your ideal, let's say, process in this? How would you improve that continuously?
Well, for me, we have our concept of three-dimensional healthcare that we made, and that is you have the biometrics, you have the social wheel. There's different social wheels now, but it's like what's on your. You have your healthcare, but you also have your housing, your depth, your abuse of substances, maybe your medication, but also your zingeving, your
meaning of life,
your meaning, your purpose and your meaning, and what gives you purpose and meaning, and all these can be filled up with self-help programs, with regulated media
interventions.
Media. Just like you get there are information sessions, but there's also self-help structures that are made that people can just do themselves when they find, hey, I'm not doing so well, before they even go to the healthcare. And they would be able to make all kinds of lists, like if you have a headache, you can have a diary of your headache. What have you done? When this has happened? How's your sleep? We have these structures already, but if people fill them in and they're in the system, we can see them and save time on each time they come to our practice. Like when someone comes to me with a headache, I do some work, but often I have to send them back. Okay, I want you to do this for me. Drink enough water, do this, hold your line, and keep a diary of how your symptoms are going. And if you see a pattern and everything, and you come back to me. And then they have to fill it in, take a couple of days, come back to me. If they come to me already prepared, that's one less step, and that's me having time for someone else.
Yeah, super, because that's indeed what you said, the scarceness of the resources that are then better distributed, because people that really need help then have a doctor to care for them, and those that can more preventively help themselves and control themselves can use AMAT to do that.
And the third branch is also very interesting in there, because that's the self-report. The people report themselves how they are feeling. And the great part is that when you have a list where people report how they feel, it's undeniable, it's clear, and you speak the same language because you already heard what they feel. And if you see that like a mirror in front of you with all the different levels of where things are going, you can cut through the chase much easier and get to the same base level with the patient quicker, which is very helpful.
Great.
Because also that saves time.
And that's great.
Confusion and loss of inadequate or inefficient actions.
Super. Hey, just as a last question, if there's something you would say to other GPs, what should they really invest in if they want to reduce the administrative burden? Where do you think is the most value for them?
Well, I do like what is possible with open AIs, but I don't like that it's open. I don't want my patients' stuff to go just abroad or anywhere and they're learning
Fully
about
agree.
the people. But the idea, I see this as a tool that can actually help people navigate better within these projects. If you are like, we had these experiments together. We have this form for people with mental problems, and you showed that it can actually be read to people by the app, and just reading, hearing the answer, putting it in and putting it all together, it helps people even do this. It's like having a service officer taking care of that, so you have it easier to come in there. And also, of course it might not be perfect yet, but at least that will help people to go through it and will help everybody go through it. Also, people who can't read well or make mistakes in there.
Yeah.
And I also see it as a navigating tool, that if you're like looking, also for my assistants, we have all these protocols. It's immense how many protocols, how many well thought through programs we had to not make mistakes and not have anybody to get a problem, and they change all the time. Now with chat, with some open AI, you can navigate, like, I want to know what I should do if people want to have a vaccination for the shingles. And then, oh, here, this is our protocol, this is what it's been adapted. You can just navigate through it. And you can keep in writing in the new information. So I as a navigation tool as well for patients who navigate with their symptoms, as a symptom checker, and for people who work in the practice to find their right information without too much effort, makes them work faster and more efficient and with more security and with more certainty.
Yeah, super, super. Well, Lucas, thanks a lot for the time you spent here, and it's great talking to you. And as friends always do, we go for a beer maybe next week. And nice. Thank you for your time.
Good to see you again. Always a pleasure.
Okay, super. Thanks.